Generally, when a person comes in like that, first of all, we probably refer them for imaging, MRI and maybe CT, so that we can be sure there are no other lesions there that are contributing to that pain, no hidden neoplastic lesions, that sort of thing. So a prosthodontist can do that under Medicare. And so straight away we've got a radiologist involved. Radiologists are sort of one of those hidden heroes behind the scenes that look at things. We often use physiotherapists, and if the patient doesn't have a physiotherapist but has a chiropractor or an osteopath, I'm quite happy for them to go and see them. I'll have a discussion with them about what we need to do and where we're going, and it might be quite instructive for them to find that there's this other aspect to the pain that they've been having trouble treating. We've had to send some people to a psychologist. Now, the problem with mentioning psychologists is that often people think, I'm going to the psychologist because he thinks I'm mad, and in fact that's entirely the wrong attitude. The reason why we're sending you to a psychologist is they're a person who's really equipped to help you manage things like stress and areas of your work where you need some high-powered concentration, because that's the other aspect of TMD pain. It's not necessarily stress. It might just be that you really have to concentrate hard on whatever you're doing. Driving in Sydney traffic is a classic example. Some people find it stressful and some people just concentrate hard. And some people take both, you know. So it's an interesting thing to have to explain to a patient, well, we really think you really need to go and see a psychologist to handle this part of your life. And patients don't expect that. So patients are a bit confronted by the fact that they're getting that information from the prosthodontist when they would expect it to get it from an HR rep at work or the HR consultant at work or their doctor. They need to understand that we're doing that because the psychologist is the best person to work on that aspect of their problem. I think that's really the point.